training curriculum that you have, including hands-on, and then afterwards, we're going to have clinical mentorship to actually guide you into using what we've taught you into your day-to-day practice. We're also going to allow you to sit for international certification exams, and that will be included in the curriculum that we give you is when you sit for those exams. The seats are limited, so please, please, when Dr. Labari releases this, register as soon as you possibly can. Make sure that you do not fall behind in learning this valuable, valuable skill. I'm going to stop there, Dr. Labari, and I will entertain any questions that our esteemed colleagues have at this time. Dr. Labari, over to you.
Thank you so much, Dr. Williamson, for that very clear and insightful presentation. I believe we've all seen the great opportunity in point-of-care ultrasound for physiotherapists in Nigeria. In fact, right from the get-go, you can just clearly see that it's an instant revenue generator. Once you start using it in your practice, you've just introduced another line of income. That's a win for you, and it's a win also for your patient, because you now have more precise care. In the 21st century, a lot of research has gone into precision medicine, and we should be at the forefront in Nigeria. We shouldn't be behind, and this puts you right there. So you're contributing to the data of knowledge and also to yourself. Imagine the research you can do with this tool in your hand. So the patient is also winning in getting more hands-on and more precise care. Early diagnosis, which is so key and important in speedy recovery. And of course, the facility too is getting higher prestige that in terms of the use of this novel technology. And we also have accreditation and recognitions for facilities that use, for those physiotherapists that have their own facilities. Your facility, your private practice, or even a government institution can become globally recognized as a point-of-care center of excellence. That is a very prestigious certification. So once you have point-of-care ultrasound routinely used in your practice, you get that recognition. And for each individual physiotherapist, as we have said, you get the certification and the recognition globally for being an expert in that field. This opens up a lot of opportunities for you globally and also for academically in terms of research. Please, it's very important that you check the link and fill the form. There's a Google Forms link on the chat section, please, so that you'll be able to get your CPCME/CPD points certificate. Please, it is so important that you fill that form. It's very, very important. Please kindly mute your mics if you're not speaking. It is very important that you fill that form. And yes, we have this program is also available for undergraduates. We'll be giving you more information on the on how we go about it for undergraduates. But for undergraduates, because of the load of work you have, we'll focus more on normal anatomy, so that by the time you are finished, you'll be able to, let's say when you're doing the internship, you quickly grasp the so many numerous pathologies that are available. There are also other materials as regards this lecture. Okay, someone says the link isn't working. I will try to, let me repost it, and I believe we will send it to your, let me see. Because I just tested it and it seems to be working. Please, can more persons try so that we get. Okay, somebody said you just filled it now, so that confirms that it is working. So please check your browser and yes. So thank you so much for that response. Yes. Um, Dr. Williamson, we want to thank you once again for this very wonderful and insightful presentation. Please, we would have to excuse Dr. Williamson because he has another meeting now just immediately after this, and it's with the Ministries of Health of one of an African country. So please.
Barry, before he leaves, let me just say thanks to him. This is Rufai. We had a meeting from the board registrar of the board. I joined today as a student. Let me thank Dr. Williamson so much for the great job. I'm very happy. I'm someone that believes in discussing something and then putting it into action. I can see you are like that too, and I want to appreciate you before you leave. Thank you.
Thank you, sir. Thank you very much. And this has been my pleasure and my honor, along with Dr. Labari and my instructors. I think I had two of my instructors on this call too, if I'm not mistaken. But I am so excited to be able to train your constituents and to train the people that sit under you, because they speak very highly of this society. And I think that this society can change. There's a question that says, does the scope of practice, and somebody just typed it in the chat, does your scope of practice in Nigeria cover this aspect of diagnostic ultrasound? I'm going to answer this from an African context. POCUS in Africa is so new that there is not a scope of practice invented to handle it as yet. So we have the chance to start and create a niche when there is no niche. Kenya has just created a point of care scope of practice for obstetrics, which we help them write. And that is brand new. That was created in 2024. That is the only scope of practice for POCUS that exists in East Africa when it comes to just obstetrics. There's no other point. So we have the opportunity right now to sign up and actually learn this before a scope of practice is invented, so you can now guide the way it goes. So thank you very much for that question. Thank you, sir.
Here again is another opportunity. Thank you so much, our dear registrar of the board, for we are so highly honored to have you here. And we've seen just another opportunity for the board to lead the way when it comes to the scope of practice for musculoskeletal point of care ultrasound, or point of care ultrasound in general. As many body regions as are concerned for the practice of physiotherapy in Nigeria. So it's, as we will say, the ball is in your court and the entire field is in your hands. Please, just as a reminder, before we will be moving on to our next presentation, I'll also be sharing the slide, just as I shared the slide for the first one. I'll be sharing that very soon. Please remember to fill the form so that you can get your CME/CPD certificate. It is so important that you do so. It won't take so long. Yeah, please kindly fill the form. Do we have any? Okay, I think that's that. So let me, without wasting any time, let me just invite the next speaker that would be presenting on the importance of point of care ultrasound in Nigeria, because we need this localized, we need this embedded in our system. And we're having a doctor of physiotherapy, Dr. Babatunde Ogundumade, who works at Jos University Teaching Hospital. You're highly welcome, sir, and we are so honored to have you. Over to you, sir. Thank you so much.
Thank you very much, Dr. Labari. I want to thank Dr. Williamson for the noble effort that he made in introducing these products and also for his presentation, which are quite explicit. We go into the second presentation now. I recognize the presence of everyone on the log, including our registrar and Dr. Labari too. I will be taking the second presentation, and it's still, the title of this presentation is on the importance of point of care ultrasound POCUS in physical therapy and rehabilitation in Nigeria. I assure you, as we have listened to the first presentation, that this is the way to go, because we are going more diagnostic in our practice. We need to be so specific about what is the problem of the patient so that it will direct the intervention that we're going to give to the patient. And if we begin to think along that line, which has been the thought really for the past few years, it means process of diagnosing need to improve with time. And bringing POCUS to bear now is positive in that direction, in improving the diagnostic. So we'll be going through this outline. We'll be looking at the lesson objective. We'll be looking at introduction, overview. We'll try to explore the basic physics behind this product we are talking about, behind this particular equipment. And as well as the frequency, we also look at the probe is used and how to care for the probe. This is sort of training for us, even though the elaborate one is going to come subsequently, as we have been told by Dr. Williams. Then they will look at the role of physical therapy, the clinical application, the guided interventions, the benefit of its use in Nigeria, the challenges and limitations. We'll also try to explore the implementation strategy as well as the clinical practical use of it before we begin to look at the future directions, and we'll draw down and enter into the session of question and discussion. By way of lesson objective, we have these 5 laid before us. At the end of this presentation, it's expected that each of the participants on the log this evening will be able to understand the principles and application of POCUS in rehabilitation medicine. In our practice, we'll be able to understand the principle and the application of it. Secondly, we'll also be able to identify the key clinical scenarios where this POCUS can enhance our practice. Thirdly, we should be able to demonstrate how POCUS will improve diagnostic accuracy and treatment monitoring. I will be dropping to us some data that shows the clinical efficacy of this particular equipment we are talking about this evening. Then fourthly, they would see at the end of this session together this evening, each participant should be able to recognize the role of POCUS in guiding interventions. And lastly, to be able to look at the opportunities and challenges that present before us in Nigeria as we explore the use of our POCUS. This, we've seen a model given to us earlier on by Dr. Williamson. This is also a very portable model of it, and you can see it's handy. And you can now see why its name is called POCUS, point of care ultrasound. It is brought to the bedside of the patient. It is brought to the bedside of the patient. It's a significant tool in this modern day diagnostics. And then it's brought to the bedside of the patient, of the client, and its intention is to be able to facilitate the diagnostic process of it in our clinical setting, which of course include rehabilitation, which is our focus in this particular presentation and our being together this evening. And it's because it actually presents high quality image and clarity. Dr. Williamson was able to give to us some pictorial of it. I was so happy with the issue of the TA that he discussed extensively. We are going to look at it when we go on in the course of this presentation. We already know, we've been taught that once you notice gap at the end of the tank-dual-clis, it's beginning to point to the direction that the patient may have what you call a TA rupture, particularly when the gap begins to get to as much as 5 cm. And it's been able to demonstrate through the use of POCUS how that is feasible, how that can be easily picked up and be able to enhance the diagnostic in terms of a TA rupture. So in the context of physical therapy and rehabilitation, this POCUS actually provides a dynamic, non-invasive approach to musculoskeletal, neuromuscular, and functional conditions. And you know, because in Nigeria here, we also have different aspects of clinical practice in rehabilitation in physiotherapy in Nigeria. We have cardiopulmonary, we have geriatric, we have orthopedic musculoskeletal, we have pelvic O&G. We see the relevance of this in different aspects of this practice of physiotherapy as we begin to go on. By way of overview, POCUS actually is being used seriously all over the world in emergency departments. And studies have shown that its use is approximately 21% of eligible patient encounters every time. And then it's been shown that it has helped to guide procedure 37%, including cardiac assessment, and that will be interesting to some of our colleagues that are into pulmonary physiotherapy, and also in the issue of inferior vena cava evaluation (IVF). That is about 11%. Inferior vena cava has to be the major vein in the body that remove all the deoxygenated blood from the lower leg, from the pelvis back to the heart and go into the right atrium for it to be oxygenated. So very, very important in the use of all this. Then, as the clinical significance of POCUS in this IVS that I just discussed is seen in the fact that it can show the diameter of the inferior vena cava, it can show the collapsibility of it as we begin to evaluate, and also show the volume status and the hemodynamics. We can now see that it can really be of help in that aspect of our clinical practice. And daily usage among our trained professionals has been shown to be very common. That's to show to us, as many have been wondering that, how about its usage? Are people patronizing it? Are people really using it in clinical practice, or is it just something on the table? It's not just something on the table, because 51% of users employ it daily and 38% actually use it at least weekly. We can see that the frequency of use is there. And then still talking about the overview, POCUS actually changed diagnostic in as much as 50% of cases and improve the diagnosis of patients by as much as confidence interval of 89%. We see something to be relied on. Beyond the, we'll still go into our diagnostic test. Beyond the diagnostic test, we now see that this actually can pick diagnosis easily for patients in each of the conditions that we'll begin to talk about. Then it leads to early detection and also assessment of the capabilities. It is the clinical judgment to be able to decide easily about what you are going to do as you examine patient. It enhances your diagnosis, and it can also be used to monitor patient. We are going to see some of those examples very well, and also ascertain helps in procedural accuracy. Still talking about physical therapy, it helps us to be able to confirm what we are suspecting. Like in the case, I listened carefully to Dr. Williams when he was presenting. Like the use of this POCUS now actually confirmed the line of thought in the examination of that patient that was presented with initially quality A rupture, but which was confirmed through POCUS. So it helps to confirm, to refute, or to narrow down differential diagnosis in particular patient with particular reference to the example that we have given before. It is not just an equipment that operates anyhow. There is a basis. There's a science behind this operation, and it's a simple physics that is behind this operation, and it still has to do with piezoelectric effect, the piezoelectric effect of it. It uses what we call ultrasound waves to generate image on the skin, just like our traditional ultrasound. Physiotherapists on the log this evening who are used to therapeutic ultrasound anyway, they will using the word ultrasonic wave will not be a bit different from them. Now, this vibration of this piezoelectric crystal that is at the tip of the transducer, what was held down, that particular portion of that machine that you see that is plugged to it and projected out with a little metal on top of it, it's called transducer. It generates specific ultrasound frequency. That now, once it generates that frequency, as you put on the part that is being used, like I put on the TA region for the diagnosis we want to make in the previous example, it will help to create ultrasonic waves. And then when this ultrasonic signal will now penetrate through the soft tissue to the area that is being affected to, and it will return back to the transducer head as a reflected ultrasonic wave. These returning waves are the ones that are now converted to ultrasonic image on the scene, and that is what is now going to be viewed. It's a simple process like that. Generate ultrasonic waves and penetrate through the tissue and then reflect back to the head of the transducer and cast an image. And that's essentially what we call piezoelectric effect. And that's what you see here now where I put my cursor. You see it being applied now to this region. And when it applies to this region, it brings up a wave back onto the head of the transducer and a cast image on the screen. And that's what we'll be seeing. That will now confirm to us whether we are refuting what we are suspecting in the management of that, in the assessment of that patient, or we are confirming there are frequencies of operation. This is inconsistent with what was also presented earlier on, with some specificity in this case for some that were there in the early presentation. Now, POCUS devices actually use transducers that operate within the frequency of 1 to 18 megahertz. Yes, if you notice in the first presentation, without a bit of specific anyway, he was talking about some high frequency and low frequency. This is the practical point of it now, and it's further broken down. High frequency of it is greater than 10 megahertz. Low frequency of it is less than 5 megahertz. The high frequency of it is used for superficial structure. When you are exploring into vascular, like the example I gave onto you the other time in terms of inferior feather kappa evaluation, to look at the diameter, to look at the collapsibility of the vessel, the volume, and the hemodynamics of it. Now, it is due to and the reason why it is operating at that frequency is because it's due to high resolution, but it has shallow penetration. And when you look at the structure that are used in that place, it doesn't really need so much penetration like skin, vascular, musculoskeletal. There is another one of low frequency, which is less than 5 megahertz. That one is used for deep structures in terms of abdominal, cardiac, and because they cause what we call deeper penetration for lower resolution. Then there is probe. What actually contact the body is called probe. What contact the body is called the probe, that is moving all around like that is called probe. And then this probe actually, there are different probes. I will maybe look at it and we'll look at the care too, because this is sort of training onto us as we expose the use of POCUS onto us. Because as we also use it, we now know how to be able to care for this particular equipment piece, and we'll be able to help our patients. So the probes are essential tools in medical imaging, which provide critical insight into the diagnosis and treatment. The probe, they come in several varieties, depending on the application, whether it's external, whether it's endocavitary or intraoperative probes. Those are the different types of probes there were. For the external probe, they are typically used on the skin surface, like the one we saw before. For the endocavitary probes, they are designed for internal examination with transvaginal or transrectal scans, which is also a possibility. For people in pelvic floor and GD will be relevant onto them, because in some instances, this actually do take place. In the process of one of my studies, I was exposed to this, and I saw how this was actually being carried out. Then there is this also of intraoperative probe, which are used during surgery. But when you look too much onto us now, we'll look at the external probe, and the endocavitary probe will be somehow relevant onto us. And when you talk in terms of safety and infection control in the use of our ultrasound probe, there is need for proper sterilization for infection control to prevent infection and also to maintain patient safety. This is the way to go for it. As we care to get diagnosis, also care that the patient still take well care of. And the issue of the probe should be kept aseptic all the time. And the different types of ultrasound probe actually require specific sterilization method. We need to take note of it. The superficial one will be different from the other one that enter. Now, the external ultrasound probe actually requires low-level disinfection, because it doesn't go down into into mucous membrane like that. They don't have contact with the mucous membrane. So their infection control is actually termed as a low level. So the common disinfectant that are used are like something they call quantorial ammonium compound, and also alcohol-based solution that will be able to take care of that. But there is this high-level disinfection, which is for the endocavitary probe. As you have seen the two slides before that I gave, the endocavitary probe actually enter into mucous area like the vaginal area, like the rectal area. So it contacts some mucous surfaces. So there is more likely to issue of infection there. So it actually necessitates what we call high-level disinfection, because of this contact they have with the mucous membrane. And those high-level disinfectants are things that are called like a glutaride and autophytaride, OPA, and also hydrogen peroxide. They are solutions that can be used to clean. The intention of all this is to ensure that sterilization is carried out all the time. Now, we need to take note of this. We need to use it. We need to have it as part of our knowledge so that it will, we'll harm ourselves with it as we go on, as we get exposed to the use of this particular device. Now, regardless of actually the method that is used, which it depends on the manufacturer, they are going to give how do you call this specific instruction for sterilization process? So the main thing is to choose the right sterilization method based on the type of probe. Just take note of that. And then there should also be routine inspection of this probe to ensure that to detect any damage to it or any harboring of microbes that need to be cleaned up from time to time. Now, what is the role of this POCUS in physical therapy? I want to tell you this evening that it has role in musculoskeletal assessment, in neuromuscular assessment, it has a role in functional and dynamic assessment, it has role in respiratory care, which is called Blue Protocol, it has role in cardiovascular evaluation, which is called POCUS. Now, let's go through them one after the other within split of seconds. Now, for musculoskeletal assessment, we have muscle morphology and architecture, tendon injuries. Let me say the fact, okay, and tendon rupture. You know, I told you about this slide earlier on in conjunction with in reference to in particular reference to the presentation by Dr. Williamson. Now, we've seen that in the issue of tendon Achilles rupture, and it's been able to prove that we can even see beyond that. It wasn't just that it told us, we saw it on the screen, we saw it on the pictorial that there was actually tendon rupture, which confirmed what was seen about 7 centimeter gap earlier on in the course of examination of that patient. The issue of joint effusion through and sinusitis, ligament integrity can be shown here as part of our musculoskeletal assessment. In terms of neuromuscular evaluation, it talks about peripheral nerve visualization, muscle activation patterns, detection of muscle atrophy, and fatty infiltration. And you see, you know, most of the patients that we see that present before us, they actually have a lot of muscle issue. We cannot see how important this POCUS will be for us as physiotherapy in diagnosing the particular problem that the patient has, the condition of the patient. Then, see functional and dynamic assessment. We have real-time movement analysis. I'm made so much elated with this part because we are movement specialists. So this will help us to be able, it's not just a static issue alone. There's issue of dynamism, dynamic movement that is introduced into it. So it can help in real-time movement analysis, and also help to assess the muscle contraction and coordination, and also a sort of biofeedback during the rehabilitation process of the patient, which is also what I call a self incentive to the patient, because the patient may also be watching it and begin to see it, and when the patient is seeing that he's performing better, he will also still want to do more. You know, there is a hope. Then the issue of respiratory care for those in a cardiopulmonary cell called Blue Protocol, or in case of acute respiratory failure, in case of dyspnea, which includes things like pleural effusion, pneumothorax, and areas of lung consolidation, can be proven and shown through it. And very lastly, there is this issue of cardiovascular evaluation. Focus cardiac ultrasound assess issue of ventricular function, pericardial effusion, increase systolic function, tamponade, and also can be used to increase the diagnostic accuracy for DVT. I'm sure that will be of significance to us, not for all of us, because it's an issue that is discussed and that is common in the issue of management of patients. Now, the clinical application of it now, we see it in pain management, which can be used in the identification of pain generators and also to monitor response to therapy. There's other application in sport rehabilitation, in the early diagnosis of sport injuries. I'm sure this will be a plus to people that are into sport rehabilitation. Our teams, our sportsmen will be able to perform better because their injuries can easily be picked up and then be monitored from time to time, and also to be able to ascertain their readiness to return back to play. Also, post-surgical rehabilitation through to monitor tissue healing, detecting complications and fluid collection, and then chronic conditions like stroke rehabilitation, which of course we are into osteoarthritis, low back pain evaluation. Now, what are the guided interventions? This actually has been elucidated in the previous presentation by Dr. William. I'll just highlight them out for you. dry needling, guidance, injection therapy. You saw it when I was guided injection therapy after diagnosis had been made, then soft tissue mobilization, targeting, and then trigger point identification. What are the benefits that we can derive of it in our country, here in Nigeria? We can have the issue of cost-effective imaging alternative. Yeah, because it's bedside, it's handy, and it gets result in time. The portability is there, the accessibility is there, both in rural area and in urban setting that we have in our climate here. There are also reduction in referral delays as we put it, but seek to put it into use. Then there is improved patient engagement and education. Patient will see this is what is going on with him. There's nothing as good as for you to know this is the real problem. They know it's like issue is set to about 50%. So they know, they are engaged, and they are educated. And then they also enhance interdisciplinary collaboration. Yeah. What are the possible challenges there? Limited training opportunities as of now, but with this that is being thrown up, there will be more opportunity to be trained. And that's why I want to challenge you to ensure that you are part of this as this is being unveiled from time to time, because there's actually need for training before you begin to get it. You see Dr. Williams talking about certification that is globally recognized. It's only just refresher, even have to cross border. It's only just refresher courses that you have then. Initial cost of equipment, we can see it as part of the issue of limitation for now. There's a need for standardization and certification, which I've talked about. The resistance to adoption, which will of course be broken down with this kind of literate session that we are passing across to you. I'm sure by the time we are closing the log tonight, you will be so happy about the knowledge that you will be able to put into POCUS, and you'll also be so happy about your profession that it has advanced to a level that immediately a patient walk into your center will be able to pick the diagnosis of that patient beyond the test that you are going to do. Then there's so that will be able to resolve the issue of possible resistance to adoption of it. And for clients whereby they will still see resistance through this that we have done today, for some of us that are partaking of this, we'll be able to educate such that this is the advantage of this particular diagnostic tool. Then issue of regulatory and scope of practice consideration, which has actually been addressed by Dr. Williams, and I know MRTB is on the log tonight, and this evening they will also look at that. What are the implementation strategy? As we begin to round up this session. Now, these are the implementation strategy. Training and capacity building is there. We are going to have structure CME. Please, if you're on the log tonight, if you have not filled your CME form, go and fill it. It's been put in the chat box. I've seen it being repeatedly propped up to us. Please fill it, write the name as you want it on the certificate, because the certificate will be given. But if you don't fill it, you are not going to be given anything at all. So there are going to be structured CME program, and this is going to be integrated into physiotherapy curriculum. And then there's going to be equipment deployment. Let me also tell you this. This is very, very important. This is very, very important. It's going to be integrated into the curriculum. I told you that exposure to the issue of ultrasound is very, very important to us as physiotherapists. Is going to help us. That's the way to go. Now, equipment deployment and ultrasound devices are being brought to us. Policy and regulation, collaboration with professional bodies, regulatory body, and then the research and evidence generation will be there. There will be more opportunity for local studies to be done on our local setting now, make it even more relevant to our local setting, and throw more opportunities and better way to be able to manage our patients, and also acceptance to our community. And these are the classical practical use of POCUS. Can be used in rotator cuff injury assessment, in tendinopathies, in ligament injuries, in quadricep muscle monitoring post arterial cruciate ligament reconstruction, in rehabilitative ultrasound imaging, whereby you have visual feedback, then assessing tissue healing like tendon thickness, ligament remodeling, in dynamic imaging of structures during movement from superior to static, when you compare it to the static MRI images. And then you also have what we call ultrasound guided rehabilitation in stroke patients, and also screening for red flags, conditions like DVT. I'm sure that is of interest to some of us. We'll be able to screen for the red flags like deep vein thrombosis, DVT. What's the future direction? The future direction is AI integration in ultrasound interpretation, tele-ultrasound for remote support, and expansion into community-based rehabilitation. Ooh, very important. People in community physiotherapy will know this will boost their practice and actually help us as we begin to look in the dimension of our primary healthcare administration of rehabilitation in our country in fulfillment of the World WHO Vision 2030. In conclusion this evening, now, I want us to know that this POCUS actually represents a paradigm shift in physical therapy rehabilitation in Nigeria. It's a paradigm shift. And it's a paradigm shift that is worth of applause because things are getting better in terms of assessment of patients, in terms of getting diagnosis of patients, but it need to be integrated into our practice to be able to have precision in diagnosis, to be able to guide our intervention, having been able to gain precision in diagnosis, will now be able to have guided intervention, not just any intervention, and this will definitely enhance our patient outcome. And with proper training, I can assure you as a roundup that with proper training, policy support and investment, POCUS can become an essential tool in modern rehabilitation care here in Nigeria. Thank you very much. I hand over to Dr. Levari for rounding up. Thank you.
Thank you so much, Dr. Babatunde Ogunjumade. We've received 2 heavy doses today. I don't know if I'll be able to stand up from my chair anymore. This has been very, very insightful, and the opportunities that we've seen through this is just so much. And you can even say that it's a bit overwhelming. The presentation was so clear and with just key insights on how this point of care ultrasound affects us directly in Nigeria. Thank you so much, sir, for that wonderful presentation. And I also want to once again recognize the registrar and also ask if he would want to say anything to everyone in this meeting, and even as we move on to other things and round up the program. Mr. Registrar, sir. Okay, so I guess it's not currently on, but it's fine. So we've already seen a lot has been enumerated to us, and we've seen the various opportunities. Please, once again, we're just sending out this reminder that we fill the CME, CPD certificate forms. It has been posted. The lecture slides and other materials that relate to this conference has been sent to the chat, and then also a WhatsApp link for interested participants. I believe we should all come on board in this program. So we aim to start, as we mentioned, we are going about this program in phases. What we are doing now is phase 1. We still need to get certain approvals for phase 2, and we still need to get certain approvals for phase 2, which we are currently working on. But for now, we are in phase 1. Phase 1, we entail point of care ultrasound fundamentals, soft tissue, and incorporating point of care ultrasound into each of our physical exams. So that's basically what this phase 1 will be like, as well as phase 1, very importantly, includes the deployment of a handheld Doppler-enabled ultrasound device, just as it was shown to us by the presenter. That device will be deployed will be given to every participant without any upfront cost, purely on a revenue sharing basis. We'll give you more details as we progress. So purely on revenue sharing, whereby you scan and you remit. And remember, these devices need to be maintained, and it is also part of the maintenance of the device coming from the manufacturer is part of the revenue sharing. And even at certain point too, we want Nigeria to be one of the standard bearers, even in getting the latest technology. And we want to improve the maintenance culture in Nigeria. And we are saying, see, as you use this device, new versions will come out. We've set up a structure such that once the new version comes out, you just switch without additional cost, and you get the new one while we continue the revenue sharing. There are several other opportunities, even for facilities and other things that we mentioned, but one step at a time. We hope to have 300 participants in this pilot phase, who will be trainers of for other participants that will join later on for other batches. So please kindly invite your colleagues, tell them about it. It's very important that we have this. So we want, if we adopt this, if the Physiotherapy Society in Nigeria adopts this program very early on, in full force, you become the trendsetter, and you literally, as Dr. Williamson said, and it's actually the reality as when it comes to the areas that the scope of practice of physiotherapy, you don't have any particular specialty owning this technology and this diagnostic tool. So it's all in the hands of each and every physiotherapist, in as much as the board has a big part to play, but each individual physiotherapist has a big part to play in setting what is the scope. We can expand it to as much as you want now that you are the pioneer in this field, even when it comes to Africa as a whole. So please, let's take advantage of this program. And I also foresee having that we can even have medical tourism, in terms of training into Nigeria. For, we could even have, if the community of physiotherapists in Nigeria adopts this program strongly, you have other people coming, other physiotherapists from other countries coming to Nigeria for training with the board. And we are really working to make sure that we have this firmly established. The tool is there, the materials are very there, and it's just for us to move full steam ahead. We plan to have the first lecture start June 7th. We spaced it so that we'll have enough time to prepare. So June 7th. We've also, like we mentioned, there is a link to a WhatsApp group for the WhatsApp interest group, so that because we'll be sharing other information as regards that relates to the program on that group. And the link has been posted on the chat. Please copy the link. You can also share with your colleagues and at work and all. So let me quickly just go through. Okay, so there are no questions. I don't want to keep us too long. I know most of us are coming from work and we need to rest and probably do some things at home. Please, if you have any questions, okay, so I am going to resend the link. But if you scroll, you will see it. I'm resending the two links. You will also see the slides, the lecture slides on the link. Please, you can download it from there, and we'll discuss with the various associations to see how we can post the invites to the WhatsApp group. So let me also paste this. I want to be sure I've checked of these requests from each participant. So I've posted both the CME/CPD link. So CME is usually what the Americans would call it, continuing medical education, and we're already used to continuing professional education. So you see us use those terms frequently. So With this, I think we have come to the end of this program, and we want to thank God for how this has the project has gone so far. And we also special thanks to the board for giving us the approval to go ahead, and the community of physiotherapists and the various associations that also were involved in the publicity for this program. And of course, we also want to thank each and every member of the physiotherapy community for being here, for taking out this time to be here. Please reach out to me. We will be answering more of your questions as relates to ultrasound within the scope of physiotherapy for physiotherapy in the group. So don't worry, I know you have a lot of questions. We will send that to you. Finally, thank you once again, and we hope to really make a produce a key impact in the health sector through this program. Thank you, our dear presenter, once again. And good night to everyone. Thank you. Good night.